budget numbers, and then we do our best job of trying to get that into compliance with what the county exec would like to see us do. And then all of this happens here in Human Services probably a couple months earlier than the rest of the county, because we are the only group that has a statutory requirement to present the county exec with a budget. So what I would suggest to you is that this year, we're going to tell you about our targets. We're going to tell you about how we came into compliance with those targets. And I think from a board perspective, you're going to approve it to move it on to John. And again, realizing that the county exec can do whatever he wants to with that budget or nothing with that budget. The other thing is, if you have specific requests or things that you'd like to see changed in this, what we're going to talk to you about today, we'll make note of that. You can pass that. We can pass those changes on to the county exec, and the county exec can choose to incorporate them into the new budget, county budget, or to do nothing with them. That's the prerogative of the county executive. Then all of you who are on county board know this very well. At the end of October is really when all of you get a chance to go through the details of all of the county departments and then make your recommended changes and do amendments and all of that. Now, none of that is, in my understanding, is going to change this year. So that's still definitely how things are going to roll. So basically, to streamline this a little bit for today, and knowing that we're going to go to something completely different next year, we're going to try to focus on telling you what the target is, and then telling you how we came into compliance with that target, and then update you on what that means from a budget perspective of where we added some revenue, where we decreased some expense, where we transferred some money around because maybe we had more expensive placements in some areas than we anticipated that we were going to have, and now we need to add more to certain line items. Maybe we didn't spend as much as we needed to, so we decreased some lines, and each manager will tell you what they did in their own budget section to create that happening. So basically our target, again, this year, as it's been for many years, is basically try to do everything that you did last year and incorporate all of the new money. So the new changes in personnel costs, health insurance premiums, vendor costs, try to come up with no new increase in county levy for that array. And this year was particularly challenging because we added, Janet will tell you the percentage that we added just on the salary and fringe in part that we increased because we changed things for county employees to increase the minimums for starting wages in a lot of categories. And we also adjusted people's wages based on where they technically should have been, for their years of time in the county. So it was a pretty heavy lift. We had to incorporate all of that into our budget. And also you'll see a fairly large number of new positions. And the reason for that is not that we're trying to add a lot of new staff. It's that we have a contract, especially in Beth's area. She'll talk about this. We have a contract with LSS. Half of our workers are inside the organization and half of them now work for LSS. And we want to change that at the end of the year. We just want to bring those workers who are working at LSS, we want to bring them under us, and we want to have them become employees because it's becoming too difficult to have two different processes happening for the same work.
Do they want that too?
No, I don't think so. I think they would like to continue to have their contract. But we only started to do it, and Beth will tell you more about this. We only started to do it because we didn't have the ability to add more staff in a few years ago. So we decided to contract with LSS to try them out, see how it would work. And so from there, it went from a few number of people to a larger number of people to a larger number of people. And now we have our own team, and then we have a team that does exactly the same thing that works for a contractor. And as you can imagine, things aren't done exactly the same way. And we would like things to be all run under the same department with our same rules. So Beth will get into all those details. So the largest number of staff, my point in bringing that up, is that the largest number of new staff are coming from children's long-term support. And Beth will tell you, how and why that's all happening. But there is money for that. There's 100% payment for that. So it's not like we're adding levy to pay for these people, because they are 100% paid for through the system, the state system. So, and there's a mandate that we not serve, that we always serve all the kids that are eligible for CLTS. We have to serve them. And so that's a mandate, and it's a funded mandate. And so the state says you got to do what we tell you to do. So we do it. Okay, so that is it in a nutshell, what we have tried to accomplish. So when you get into the details today, basically we're looking for your feedback on, I guess, two things. One, sounds like a good plan. Two, if you want to make some changes to it because you're not exactly liking something, then tell us what it is, make your amendments, add it to the budget, and we give it to John. You guys get done with it.
Last question.
So if you have any general questions with me, that's fine. Yeah.
Back to the LSS employees. So three things: what happens to their seniority, what happens to their pension, and what happens with vacation and other benefits?
Are you talking about the LSS people?
Yeah.
Well, when you move, there's a contracted agency. Okay. I would say to you, I don't know if LSS had a kind of benefit for longevity. I have no idea about that. But typically when we bring people in-house from a contract, like we did with,
Shelter care?
we've done it over the years with different players. Basically, we interview them, and based on their years of experience, they may start, or they may start, closer to the midpoint. It depends on, their level of skill and abilities.
But you're talking about a pay thing, whether they start at the start or they start at midway. You're talking about pay. I'm asking, where do they stand? I mean, are they now employees who have 5, 10, 15 years with
LSS?
No, Karen, they'd start over as if we were hiring someone new.
Yeah, they would start over like they just left their job and they wanted to come here and work. I mean, it would be the same.
Chances are the benefits are gonna be better for the county than they are for health.
Yeah.
Okay.
And for them, it's, they would basically, their job would be ending at LSS. And then we would interview the people that have been doing this job, because obviously we want to hire the people that know how to do their job. Chances are many of them, or if not all of them, would be people we would hire.
Okay.
So,
All right.
We
anyway,
don't have anybody through LSS that's been there that long.
and Beth will get more into the details of that
Okay.
when we get there.
I'll save my questions for
Okay.
later.
There you go.
Right. I was just trying to give you a broad outline of what we're doing.
I'd like to get an update on the new system, even though it doesn't apply for 24.
Okay.
Have we supplied all the required information to the executive that he requested?
From us?
Yeah.
Yes.
Was there 3 parts of it or something?
There's 3 parts.
They're all 3?
I'll just give you a quick, what it might, and we haven't gotten to the last part of it yet.
So we got 2 parts out of 3 done.
Second is in the middle of the process. So we
got
submitted,
1.5.
so the first one is inventorying the work. So, and inventorying the work is you identify what it is that we do. So we have programs here, and we had to take our programs and divide it into not a program, but what is it that Human Services actually does? So what is the function as opposed to what is the name of the program? So we had 76 total things that we indicated to the exec that we do. And then on those 76 items, then Janet and her team and the managers have to figure out how to redivide the expenses for those 75 areas. And before that, we had about 16 or so programs. We had 16? We had lesser number of programs, Janet.
Well, I mean, the budget's always been based on just the 5 divisions.
5 divisions, but within them, there were identified programs. And so we would put expenses to programs. Now we're being asked to put expenses to functions, 75, 76 functions. We did that, or we're in the process of finishing that part.
Correct.
And then they're going to analyze that, which they haven't done yet. And then the third step, Harold, is the evaluation or scoring of the importance of our 75, 76 areas and every other department's areas. So, and I don't know what the scoring entails because we haven't been trained on it. So I don't know like what's going to go into it. I think a part of it's going to be whether it's mandated or not, whether it serves all the county or just a specialized small number of people, maybe a scoring factor. So we haven't finished the scoring. So there's nothing to tell you yet about that because I don't know how it's all gonna. And then once we get it all done, then the question is, how is that going to translate into, how is that going to be used for future budgeting processes? And I think before that happens, what I understand is there's going to be some report to all of you county board members as to how PBB, what it is and how it's going to work and what we've initially found out about our system. And also in the same time, strategic plan has come up as another thing that the county has to complete, which is you got to have a strategic plan so you can figure out what's a priority to spend money on. So all of this will probably happen by next summer for the 25 budget. So we're not there yet. That's why John's not here today, because we're not even up to speed yet on all the parts of it. We did our best effort. I can tell you, we all really hoofed it to try to get the stuff done on a timely basis. It got slowed down because once you submit the information, it has to be reviewed. And if it's not correct, you have to go back to the departments and get it updated. And so there's a little bit of back and forth. And the same thing will happen with the money, when all of that is figured out. Is the money in the right place? Did you put it into the right areas? And then thirdly, did you score it correct? So we've got a ways to go, Harold. I would say we're more likely to have this thing ready to roll by next summer. It was too tight of a time frame.
And I'm assuming that's countywide, it's not
That's
just a human services.
That's
issue, yeah.
countywide, and we just happen to be earlier in the budget process than the rest of the departments,
Mhm.
because the rest of the departments aren't gonna really know what to tell their boards until probably September, later September. That's kind of how it's looking. So we are like, and again, one more disclaimer, as you all remember, our budget is constantly changing because we're getting new numbers all the time. From Madison, things are changing. We're trying to estimate, okay, what did the state budget actually do for human services? And we don't even have the answer to that yet. We don't have the numbers yet for Madison. So we're just best guessing what we think we're gonna get.
Harold, to answer it?
Harold, did,
Yeah, doing the other thing that I'm wondering a little bit, is there any kind of a tentative deadline? Because sometimes if you have a tentative deadline, you can keep on working toward it. As opposed to thinking you're going in the right direction, and all of a sudden the executive comes in and say, no, I want this done in 2 months or something, and then Janet has to go nuts.
Don't do that,
Won't be your
the
first
latter
time.
thing that you said, like, you gotta get this done in 2 weeks, that happens a lot. So we're still, I don't know what the new time frame is gonna be, but I could go to the next meeting with department heads and find out that, yeah, we're still gonna get this next phase done by the end of September. We're gonna get the scoring done by the end of November, whatever it is. Because the point is, we can use the current numbers, or we could use last year's numbers to just get it up and running so that we can see how it would look. Because what we have to do is we have to do a dry, once it's all kind of in the system, we have to do a dry run anyway. So yes, he's still pushed. So my short answer is the county exec is still pushing us to have a deadline, get it done. We're not going to forget about it. I mean, he's not forgetting about it. He's just saying, yes, it's too short of a time frame. You guys are meeting in human services now. So how would we have something ready to present to you? We don't. So we just go with the old numbers.
Is that it? Karen?
Well, your last statement may have answered my question, because I was wondering, so how did the county executive take the fact that we couldn't get this done in 24 and it may push off to 25? But you're saying he realizes and he's okay.
Yeah, because I think the push is still on.
Yeah.
To do this exercise, get it all done this fall yet, and then use old numbers, but just to kind of like practice it so that by the time we get to next spring, we're now using it
Okay.
to forecast for 25. So that's the goal, I think, is just to get it done, get everything working, give it a trial run, and then be ready to roll for next spring.
Okay.
Yeah, I think that's what we're gonna be. So I think next year, we'll be talking about priority-based budgeting and how that's changed our budgeting format going forward.
Yay.
All right, well,
So now, Janet,
Janet,
Okay, so I'm just gonna kind of walk you through the document you have. And then each of the divisions will kind of address their division in this budget. So first page is just our mission statement for each of the divisions and the department. The page with the pie charts, it's kind of where the money comes from and where it goes, or revenues and expenses at a very high level. Just kind of shown in graph format. And then at the bottom, it just shows how we come up with the levy for the budget, and it's basically all our expenses less what we think we're gonna receive in revenue. So the levy that we have for the proposed budget is what it was for the 2023 adopted budget, with the exception of $35,000, which is the addition of a van that we're asking for in the budget for next year. Then we come to page 3.
So the request is the same as it, so we're looking at a 0 increase.
Except the 35,000 for
the
the
van we did last night.
request. Page 3,
Is that, sorry, one more
Go
question, is it 0% or $0 increase?
$0.
Okay. 'Cause those are two different things, right?
Yeah. So then we have just kind of a summary, again, of revenues and expenses for the whole department. And it shows what was last year and then what we're requesting for 2024, and that's where you see the change of $35,000. So that's a 22% increase. Following page compares 23 to 24 and then shows the variance for each of the divisions. Then you see that the bottom line is at $35,000.
Well, let's look at it again. Let's see.
Okay. Then what we're really going to be focusing on today is the information that's on page 5 and 6. And that's kind of where the swings were in the budget for both revenues and expenses. And it's broken down by division, so each of the division managers will kind of cover their own section. At the beginning, we talk about the labor swings that Bill touched on. So we had quite a large increase in labor. New positions was the close to 1.5 million. This year, we did have approved additional, it goes into a line called additional temp and overtime, but it's the differential on-call and beeper pay that you may recall we implemented for shelter care and the crisis center because they're 24/7 operations. So that was not budgeted for this year. So we did increase the budget for that for next year. And that's just what we kind of think is gonna happen.
And what are the green letters and the black letters?
The green is revenue, black is expense.
Oh.
And then the wage adjustment and reslotting is that process we went through in the spring, that you all recall that the county board had approved. So we estimate that that increase is about 700,000, which kind of translates to a little over $2,000 per person in the department. And then we had our normal annual wage and fringe increases that would account for the increase in health insurance and just the normal wage increases. Last year it was about 1.5 to 6 million. This year it's 1.7. So that kind of is the brief explanation of why our labor costs kind of swung pretty high. So we'll kind of save the rest of this for when we go through the divisions. Page 7 breaks down all of the new position requests. It works out to about 95% of those requests are revenue offset. So we don't have a huge levy impact. The net cost in levy, in terms of levy, would be the 86,000 that you see on that page. The remaining pages are all the line item budgets for each of the divisions, which you're familiar with from previous years, just the same format that we've used in the past. So that's kind of the brief overview. If you have questions about any of that, otherwise I'll jump into the admin division changes.
for annual wage and fringe increases, what is being budgeted for an annual increase for employees?
4%.
4%. Thank you.
Which is, so just to be clear, 2% is a schedule adjustment, which you guys have heard about, which is an automatic if you pass that. It has nothing to do with merit. So 2% is, a schedule adjustment is everybody's on a certain level. And if you want to adjust the pay upwards a little bit to make the minimums go up a little bit to keep up with inflation, although we're not tying it to inflation per se, but just as it goes up, then 2% will be a schedule adjustment, and anybody whose schedule goes up, basically, well, everybody's schedule would go up 2% essentially. And then the other 2% is merit, which again, you guys got a briefing on that, I think, at county board, that the merit would be a little bit different than in years past. It would be, so it's good. We're gonna get trained on it, hopefully here in the next month or so, because we have to start doing the evaluations by the end of August through the end of October, I think is when we do our evaluations. And then it's gonna be more of, did you complete the tasks and the activities that, you know, we said we were gonna evaluate? And if you did them satisfactorily or you did them well, you will get the merit. If something is deficient, then you may not get the merit increase. So it's gonna be different than what it was in the past. It was a little more finer hash marks of getting performance. I think all of us as department heads feel like the new system should be simpler and it should be less subjective and more, did you accomplish what you needed to accomplish last year? And if you did, then you will get the merit. And if you were deficient, you will have multiple times where you're told that you're deficient, that you get a chance to correct that so that you're able to pass it if you want to.
And it's an all or nothing.
And it's an all or nothing.
Right, because before it seemed like it was, now it's, if you do your job, you do it satisfactory, you're gonna get the merit
The
pay.
share system would go away.
Before it was, you got the merit pay only if you did above and beyond, and that wasn't. There were some jobs you can't do above and beyond, so you never could get the merit pay for it.
Well, it should be, I mean, I think it's still gonna be based on you have to do your job.
Do your job, yeah.
And do it all correctly. And then you get your merit, otherwise you don't. So you're either gonna get 2% or you're gonna get 4%. So I'm just trying to clarify, when you asked how much are people gonna get,
Thank you for that.
some people may end up with 2. Or if the schedule adjustment changes, like say somewhere between now and October, the county says, hey, we want to make the schedule adjustment 2.5, or we want to make the schedule adjustment 1.5, that would change how much people would get for that part of it. But we're budgeting for 2% for schedule adjustment and 2% for merit, which is why Janet said 4. That's how we got the 4.
Yeah,
I know you look a little.
I have a question floating in my mind.
Okay.
Could the county board change it to 3% schedule
county board?
adjustment and 1% merit?
Okay, then it still would be 4, but 3 would be automatic and 1 would be.
Yeah, I think the county.
So yeah, so you can potentially adjust it. So it could be less too, or it could be more. I mean, but we're trying to answer your question.
Yep.
How much should we budget? Yes, we budgeted 4, but it's for 2 and 2.
Board can always change it.
Any other overall questions? Otherwise, I think we're gonna get into the details of each division and their changes, and you might have some specific things for. And the positions will be tied to the divisions, and they'll talk about their position. Okay, so Janet, you're up first.
Okay, we always go alphabetically, so admin gets to go first. So on the revenue side,
Nope, and tell me what page you're on. We're
5.
still late. Oh, no, we're back.
It's fine.
So the revenue that we have in admin that we're anticipating will increase is the basic county allocation, which is funding from the state, and it's available to us for broad uses. It is broken into kind of 2 separate pieces. There's this piece, and then there's a piece that's specific to child welfare, which is in child welfare budget. This is kind of our best guess at where we think that's going to be. for 2024. Typically it does increase somewhat, so I think that's a pretty good estimate. Then we have our expense changes. We did change the telephone budget. We reduced that by 50,000. It's kind of based on historical trend. The county has made some changes with their telephone contracts that's generating some savings. So it's kind of countywide thing. There's a new accounting entry under bad debts expense. And it's something that apparently the auditors recommended to the finance department, and it's really an entry that they make at year end. But it has to do with the invoicing that's done by the finance department. What they're doing now is as soon as we submit the invoice to someone, they're booking that as a revenue. And then they make this adjustment at year end for any revenue we didn't actually receive, they back it out. So there's kind of a cost here, but in child welfare, there's the revenue. So it really does offset at year end. It's purely an accounting entry change. But we need to have it recorded in the budget this way.
Janet, I'm just gonna stop you. The reason you have these rulers in front of you is if it's hard to follow like what line you're on, if you just, you can use it. I'm just pointing it out because people are like, well, why do I have a ruler here? It's because if you want to like keep track of the lines, it might be helpful.
Same thing with this. Some people prefer, it's because the rulers are clear, so you can still kind of see the lettering. So if you
Well, I
prefer,
don't know.
Hey, we never got one of those.
sure, they're all over.
Yeah, we got,
He didn't get a green.
I didn't get a green one, but that's who got one.
Anyway,
You didn't get a green
I didn't get a green
I had to
one,
start
dang.
over.
Boy, I got ripped off. Well, that's because you had,
so
Whichever
anyway, so
one.
we wanted to
Because Renee
include these
gave it to
because
me.
sometimes it gets a little hard to follow which line we're talking.
no big deal.
Sorry, Jen.
I like the rulers.
We didn't tell them about the rulers.
Yeah.
Then you can hit each other later.
Yeah, and there's
Just
no,
feels like
there's no,
everybody.
there's no slapping of hands if somebody gets out of order, so.
Yeah. So then we have our capital outlay request, which is the replacement van. We have not requested one for 2 years. Our oldest van is 12 years old and our van with the highest mileage has almost 140,000.
Yeah.
So some of our maintenance costs are going up to the point where, you know, when you start to get nickel and dime on your repairs, it's kind of time to replace your vehicle. That's kind of the point we're getting. So.
Okay, will we get a little bit of an upgrade on our van? Because the scaled down model is really hard to step into because there's no place to step. And I can't remember some of the issues that I had getting into the old van. I thought, we need to step up our, you know, seems like a step is not that much of an accessory, but will we?
I can add it to the list
Okay.
of what we request. I know there's certain things that are really important to staff that we try to
We're not buying it for you.
What?
We're not buying it for you.
I knew I needed a ruler for something.
So anyway, we kept that out of the general request because John also wanted, when we add things that go above the levy limit, then we kind of like identify them separately and then we can talk about them separately. And we decided to do that with the vehicle because we need another vehicle. We held off for the last 2 years and if we don't replace them on at least a 10-year cycle, I think we're asking for trouble.
Yeah.
So that's why. Yeah, and it's a whole different process because it's considered capital outlay, so. And all that has to be filled out. And then the only other thing that I noted here for a significant change in admin was the computer licensing charge. That's a charge that comes to us as an interfund charge from the IT department. And they look at the number of computers we have and the software we have and all of that kind of stuff. It's showing pretty significant increase this year of almost $60,000. What they're telling me is it's because of the conversion to Office 365.
To what? Oh, Office 365.
That is why we're seeing a pretty significant bump up in that IT charge for next year.
Because there's a per license fee, right? Per
Yeah.
user, something like that, yeah.
It's a per user per month charge. And one of the big reasons is that the storage of Office 365 is in the cloud, which means it's offsite and it means that we can have a much greater amount of storage capacity than if we have our own systems in-house. And we were bumping up as a county against kind of storage limitations and function limitations. And so rather than keep upgrading our equipment, which is very expensive. A lot of bigger companies have gone to, everybody just gets a per member per month charge for Office 365, and then all of their stuff is stored.
So per use, that's like you and you and you and not just department or not just agents. Okay,
Each person.
every person.
Right,
Okay.
they inventory all of our equipment and our software. and
License
everything.
for every
And so
person.
being the largest department,
Yeah.
obviously.
Right.
And they don't charge us back for all of the IT stuff. It's just, they've tried to identify certain charges for certain departments that the departments will need to pay for as opposed to IT. And I guess it's a debate on a county level, whether you want all of your IT charges to be run through the IT department for all of the departments, or if you want to charge back. And that's the decision that IT has made, is to charge back some of the equipment or license charges back to each department. So Sheriff's Department's getting a charge, we're getting a part, Highway's getting a charge, Parkview, and all of the departments are getting a charge for Office 365.
And do you maintain a computer for consumers? If someone comes in who doesn't have a computer but needs to fill out forms.
We do have a couple.
And so, okay, but each of those consumers aren't
No, they're not
licensed.
charged.
Okay.
Well, they're not charged, but we might have a fee for that.
The fee for the one, but
For
not for,
us, not for them.
yeah.
We don't
okay,
charge them.
Okay.
And then, as you know, in admin, we pay for like all the paper, all the general supplies for the whole department. We don't split that out by division. There's some minor increases here and there, but the way we budgeted that increase was by looking at the consumer price index and kind of what they are projecting for next year for those kinds of goods. So that's what I have for admin.
Where is that reflected in here?
Yeah, I don't see that.
If you look at the line item budgets for like office supplies.
You
See,
want to point to what page?
8. You'll see, I mean, like we had a $375 increase, so they were fairly minor types of increases.
Any more questions for admin? And you didn't have any position changes in the budget. Okay. All right, behavioral health.
Everybody? All right, so, thank you to Janet for helping lay all of this out for everyone. In the midst of also doing some budgeting, so. So going through, same page that Janet was working off of, page 5, through behavioral health. So one of the places that we have an increase in our expected revenue would be the CCS program. We have been increasing the amount of people that we're enrolling. We've also been trying to have everybody bill for more of their time that they've been working in it. Also, crisis services. We had some changes in 2023 to Forward Health. They made some changes in how we're able to bill. So right now, if we have staff that co-respond, sometimes for safety reasons as well, they're actually both able to bill for that service, whereas before they weren't able to do so. So there are several instances that we're now able to get some additional revenue in. The place that is going to be going down a little bit is the SOAR grant is the state opioid response. They've now also included stimulant use disorder as somebody that can be a recipient of using that grant. More counties throughout the state are now applying for it, so everybody's allotment went down a little bit. Both the AODA block grant and the mental health block grant, both of those were supplemental following COVID, and those will be going away in March 15th of 2024. So the portions that we are using the money for now, we are doing some non-billable codes so that we're able to track that, and Janet was able to pull numbers to make sure that that's all compensated for then for the 2024 budget.
So just to say a little bit more too, that the block grants, the alcohol and other drug abuse block grant and the mental health block grant are federal grants that come to the state, and the state passes on the grant to us. And during the pandemic, the amount of the grant got increased for the period of time the pandemic was in place. So it usually, some percentage improvement in where, if the grant was 50,000, maybe we get 60,000. The grant was 200,000, now we get 250 or 300 during the pandemic. And when the pandemic is over, it goes back to the way in which the grants were coming to us prior to the pandemic. It doesn't mean that they're cutting money from us. It just means that we're going back to the formulas that existed pre-pandemic. So that's what, when she's talking about why the grants went down, it isn't that the feds are saying, we don't think you need more money. It's basically, we gave you more money during the pandemic. Now the pandemic's over. Now we're gonna go back to funding you the way we used to. Am I saying that correctly, Heather?
You did, yes.
Okay.
Thank you.
Just to explain it a little bit better.
The next line is the MA inpatient, and that actually would be tied to the second from the bottom, the residential AODA. So Forward Health now is paying for individuals that are going into residential substance use programs. So then that also offsets what we are getting in as well. So the two kind of go together. The WIMFR cost reporting, that one is going up quite a bit. We've been getting more in. We're reporting more on even our administrative time. Some of that goes into that as well.
Yeah, it's, for CCS program, it's 100% reimbursement. So because that program is growing, our cost reporting is also growing.
I didn't bring my acronym sheet with me today.
Comprehensive community services.
I'm sorry.
It's comprehensive community
Okay.
services.
Yeah, I looked at the last page, and I thought we had this deal. No, last page, we were always gonna have alphabet soup.
So the comprehensive community service program is a program where it really walks alongside each individual that has either a mental health concern or a substance use concern, and they screen functionally eligible for the program. Also have Forward Health, which is where the reimbursement portion comes from. And with the 100%, we have the 60-40 split with that we bring in. So the other portion comes in then through the WIMCR. So our psychotherapy is able to be billed through there, the case management, we do medication checks. Everybody's plan looks a little bit different.
And WIMCR is the program that the state started back in 2003. It was originally supposed to be a one-year deal with the state that the counties would allow this to happen, and it became permanent by the legislature in that same year. And basically, it's what I've talked with you all about over the years is that we do a lot of medical assistance work. We get a lot of claiming, and the feds realize that they're only giving the states 60% of their claim. And so they provide another opportunity for states to say, okay, tell us about the other 40%. Tell us about all of your expenses that you've had doing this medical assistance work. You provide a claim to us, we will review your claim. If we agree with it, we will give you 60% of that claim back to you. Now, what's happened in Wisconsin is it used to, before 2003, it used to all come back to the state, and the state would break it up based on how much the counties submitted, right? Makes clear accounting sense. In 2003, they said, no, we're going to do the claim for you, and we're going to take a percentage. And we're not going to clearly tell you what the percentage is that we're going to take, but we're going to take it. And then we're going to give you the rest back. And then when we said, well, tell us how you calculated that, that's where we've never gotten the straight answer for the last 20 years. So when we get to why are we getting all of this money, we get a check in November or December, and Janet says, well, it's not what we were expecting. It was something usually more than we were expecting. And we don't have any rhyme or reason why that's happening. And part of our surplus confusion over the last umpteen years is because that and some other things basically come in that we can't quite explain what it's tied to and why it's happening. It's good for the county. It's good for the department. It's just, we can't explain exactly where it's coming from a county perspective, which drives us all nuts. So when you hear WIMCR and this is like the primary one that has perplexed us for 20 years, why do we get the number we get? And so Janet and the managers have done their best to try to estimate what we think we're gonna get from Wimker. And we're just guessing and guessing, but we're trying to guess closer and closer so that we don't have this big difference between what we tell you we think our revenue is gonna be and what actually comes in.
This is what always drives the rest of the county board crazy. They, why can't you figure out a decent budget? And, why can't you be closer? Why do you end up with these? Because we don't know what's coming in. You can ask, but you get no answers of what's coming in. You don't know what the percentage is. You do your best to guess and.
And I'm gonna guarantee you now that budgets are getting tighter and tighter, we are guessing closer and closer, and so I don't really think we're gonna, and also this year, of course, too, we're having more expenses. I think we're gonna be a lot closer to a break-even budget than we have been in the last probably 3 or 4 or 5 years. So anyway, so when you hear the term Wimker, which again is listed here, Becky, Wimker is actually identified Wisconsin, MA. Medical assistance, yeah, that's what it stands for. But that is the big one that swings widely, and that we always can't really tell, but we're gonna guesstimate as best we can. So anyway, I'm sorry I interrupted you again.
You're good. We're on page 5. Thank you. Yep. No, good. The other place of increase is the third-party insurance that we've been able to bring in, that I would say is due to a partnership with the admin department, with the finance team. So finance team is definitely going after more billing. We're doing a lot more communicating. So if the bill's not coming in, we're making that correction, or not getting paid, we're making the correction to ensure that we're able to resubmit. And our quality assurance specialist is ensuring everything's signed more timely, and diagnostics, what's listed on there for insurance purposes, like all of that's done correctly. So I would say that's been a pretty good team effort between the two divisions. The other transfers in is the opioid settlement funds that is helping fund our diversion team that we have located at Warren King in that Connect space. So that's where that money comes. The general hospital psych, we did go down on that because we have fewer clients that are going into the placements. With everybody having insurance, or most people are eligible for insurance even through the exchange, that reduces the cost and are having to get involved when somebody is even trying to go in voluntarily to an inpatient setting. The residential inpatient, we tied that back up again to the MA inpatient. And then our CVRFs, we really reduced that line budget as well. That would go into, I think some of it also is related to the caregiver shortage. There aren't as many CVRFs available for placement. We are doing more than like the CCS program that we were talking about earlier, following individuals in the community and providing more of that intensive in-home service. We're doing more of that to offset it. But,
So CBRF is community-based residential facility, up to 8 beds. And prior to our crisis center, we had 2 8-bed facilities. One was Towards Tomorrow and one was Summit House. And it's just a level of certified home where you have to have 3 shifts and you have to provide a certain array of services for mentally ill folks, and they're called community-based residential facilities. So that's what Heather's talking about, is that we're placing less, in part because some of the facilities don't have enough staff, and it's probably not going to change quickly. So we're trying to keep people in place where they are and not have them go to a CVRF, and so you can save some money, right?
Yeah, absolutely.
I have a question. For the general hospital site line, there's, you mentioned with people having more people having insurance, was any consideration given to the fact that a lot of folks who were on Medicaid through the pandemic and we're now unraveling from that and may no longer be eligible, they'll be losing insurance and may not be able to afford marketplace coverage either?
We looked a little bit into that. I'm not sure that'll affect that. So there's the general, and then there's more like the specialty. So the general is which be like Mercy or Theta Care. They have behavioral health units. They're more willing to accept individuals on a voluntary basis who have insurance. So this wouldn't affect like Winnebago Mental Health or like the Fond du Lac inpatient unit, which are both county involvement is required for both of those.
So this line is with voluntary commitment?
So
or something?
some is voluntary and then some is also correct, where crisis is involved and places the emergency detention on someone.
So it's a combination?
It's a combination of
Okay.
both. So in the past, well, actually still currently now, if somebody is looking for voluntary admission to a psychiatric hospital, but doesn't have the ability to pay or the ability, one of our overall regulating codes, DHS or Chapter 51, we have that responsibility to help fund and serve somebody that's in there. We wouldn't take away their right or their ability to go in voluntarily. By superseding that, by putting them on a detention, we would allow them to go in voluntarily and then would work with them on helping fund that, coming up with a payment plan of sorts, and then also working with them on ensuring that they have the appropriate follow-up care afterwards. Does that make sense?
Okay, other questions for Deval?
I do also have a couple on
yes.
page 7. We had some changes with in behavioral health to the position request. So the intake specialist position and both the mental health crisis specialist co-responder that we have with the Oshkosh Police Department, both of those are current project positions. So we would be looking at adding them permanently to the table of organization. And then one of our psychotherapist position is a part-time position, and we would be looking to make that a full-time position. It's an individual that works with youth, families, and adults. So we're hoping that that will help across the array of need. Any questions?
Yes. Okay, so your psychotherapist, the expense is only 54,900, that's all, where the intake is getting 87 and this is getting 54, does that include benefits?
It's a part-time.
You said it's gonna be
Position already.
full-time.
That's half of it, because we already have 50% in the budget, so this is the increase
Oh,
by making it full-time.
okay, sorry, thanks.
And you said it was mentioned earlier
Okay.
that 95% of the costs on this page are revenue offset. So do any of those fall into that category?
Yes, all 3 of those positions would be able to bill. The position that we have with the Oshkosh Police Department, the city actually gives us money as well every year to pay for a portion of the position. And then she's able to bill for the other portion of her time. And then we have a grant that she's able to put a little bit of her time into for preventative work that she's doing when she's meeting with individuals in the community.
So if you look at the column net cost, after all of these positions on this page 7, there's a column called net cost.
Yeah.
And that's the difference in everything, adding these positions, adding all the extra revenue, what's it still gonna cost us? So that's what it's gonna cost, the 86,079, to add this list of 20.5 FTEs. Which that's why we're saying the cost is very small for adding these, because of the monies that back those up, whether that be Medicaid or whether that be grants or whatever else. They're covering the vast majority of the cost of these upgrades.
The supplemental portion, the money that we got related to COVID, that Bill was explaining earlier, that's the grant funding that we had used for those top 2 positions to help support those. Because it worked out nicely as a project position to be able to try something that didn't then have a cost on the county. And then we were able to monitor to ensure that we will be able to bill for the position by how they're doing their reporting.
Do these proposed positions, do they have to be prior approved by human resources?
They have to be concurrently approved by Human Resources during the budget process. Yeah, I mean, we'll have a talk with the county exec, with HR at the end of August, and that's when we go through this list again, and they can say whether they want to bring them forth or not. I mean, we don't do that independent of them. We just tell them, here's what we'd like to do, and here's what we think it's gonna cost, and then you tell us whether we could keep them in or not.
Announcements?
Oh, thank you.
Alright, my turn. Okay, so back on page 5, the child welfare. So our increased revenue, just because child welfare doesn't actually bill for anything. So our increased revenue is related to subsidized guardianship. So what that is that children and youth who are in a foster home, and that's gonna become a permanent option for them, that the foster parents are willing to be guardians. The state now, in certain circumstances, is reimbursing us for that guardianship and for continued placement. So more of our guardianships are being able to be subsidized. So when that happens, we get some increased revenue from the state as a reimbursement.
I was just ice adjusting in the cooler.
And then the next one is youth aids, and we're anticipating some increased funding from the state. That's related to youth justice, juvenile justice, kids who are naughty, getting a little more money there. Kinship care grant, what this is, and there's an offset here, is that they have, the state budget involved a $75 per month increase for kinship. And between the federal government and the state government, they fund that. So if it's going from $300 a month to $375 a month that they're gonna get, so we'll be reimbursed. So those two just will offset each other. Hopefully that makes sense. And then targeted safety support. This is one of the, again, this comes from the state. This is one of the ways that we are able to keep kids in their home. We have throughout the years, tried to be creative, do whatever we can. The state does fund a portion of that. If the kids all meet the criteria and the parents meet the criteria, the state does reimburse us for some of those costs. So they're supposed to be giving us more money this year in order to be able to do that. And then our increases are the child RCCs, which is the residential care centers for children. We've talked a lot about that we have more kids that are going into that level, that high level of care. Those are very expensive. So we did budget anticipating that some kids will be remaining in that level of care. But not, kids move around quite a bit. So that one will change as we go. Kinship, I already talked about that's offset by that additional revenue. The shelter care facility, we reduced that because now that it's in-house, we don't have to pay contractors. Facilities pays for quite a bit of, and that's in their budget. And we aren't also using other facilities. We're able to manage it within our own shelter care. Juvenile correctional institution, we did drop that back down a little bit to budget for 90 days. So what we have is that we're gonna budget for 90 days because we're not sure that we're going to have anybody in that level. That's our highest level for a kiddo to go who has committed a crime. And the one that's there right now will be out in October at the latest of this year. So right now we don't have we're not anticipating anybody being there next year. Certainly if somebody does and we need to, we will come back to you guys to say, hey, we have somebody that's there, and we will come back to you to say we need to get some more money in that line item.
The county exec asked us to budget for a quarter of a year just to have money in the account. So that would get us approximately 3 months, and then we'd have enough time to come to you and then go to the county board for a transfer should we need it. So that's why she's making that request and dropping it to just cover 90 days.
And then the last one on here is the building and maintenance costs. And actually, I looped that into the shelter care, sorry about that. But with shelter care and potentially, hopefully tomorrow night, Silvercrest being a county run facility or county owned building, excuse me. then we won't again have to be paying for the heating and the lights and all those kind of regular maintenance that now becomes facilities fund or the rent.
So facilities budget is probably gonna go up when you see that in October at budget time. But it comes out of our budget. Now it's been coming out of our budget. It will be transferred over to facilities because they pay the electric, they pay the water, they do the maintenance, once the building is under the county.
Well, this has nothing to do with the rent that we're saving now, this 81 grand.
It would, yeah, that we're also not paying that rent, right?
Thanks.
I've had people ask me, are we looking at all to, you say like Lincoln Hills in the Winnebago County area? Is that, no?
No, we're not.
I've said no, but I thought I should check just in case.
And honestly, I don't know exactly where it landed. Right now, they're building one in the Milwaukee area. There's been one talked about up here. I don't know if that's been.
The one that they've said maybe, and this is a long shot, might end up in the Green Bay area.
Green Bay,
but not
yeah.
here.
Okay.
So, I mean, but again, that's a replacement for Lincoln Hills Copper Lake, and they've been talking about it for, I don't know, almost 10 years now, about getting rid of Lincoln Hills and Copper Lake and building smaller facilities in a couple of different locations around the state. But the legislature has thus far not put money into building new facilities, with the exception of Milwaukee is gonna be the first one. And then the second one I'm here to talk about is like Racine. And then thirdly, maybe Green Bay. But we're probably talking, best guess, 5 to maybe 10 years out before they get to that.
Okay.
And that's just replacing Lincoln Hills and Copper Lake. So for the time being, if we have to place somebody for a very serious crime into Lincoln Hills, it would still be Lincoln Hills. And thank God that we haven't had those placements at all, except for this one of our youth that's been there this past year. But we haven't had one for 5, 6, 7 years before that. So, and we don't want to, because literally the cost per day is, it's higher than, I didn't even look at the last projection, but it's been about 1,500 or so per day. And it's gonna only go up.
Yeah, as soon as Milwaukee opens, that's fewer kids than that'll be at Lincoln Hills. We need to fund it. All right, I should just go back a second. I kind of, real quick, just said child welfare doesn't have a lot of revenue. Basically what it is we cannot bill. It's not allowed. By statute, we cannot bill for child welfare services. So we do bill a little bit in terms of parents pay child support toward placements. There's a portion of that that we do get. And then some services like electronic monitoring. And this is all on ability to pay. Like in that case, electronic monitoring, something that we can bill for. Shelter care is something, secure detention is something. Those are things that we can seek reimbursement for, again, on an ability to pay. But other than that, we cannot bill for any services that are.
Child welfare is not a Medicaid eligible service. A different pot of money called federal 4E money it's a different pot of federal money, but it has nothing to do with Medicaid, and it's not on a per person, per service basis. It's the state gets money through 4E, and the state then turns around and gives the counties money through the AIDS formula. It's a different pot of federal money. It's a different thing altogether. And so what she's trying to tell you is that Medicaid is not able to pay for child welfare services ever. So we will never have a discussion about Medicaid and child welfare. Now, some of the kids in child welfare may be receiving behavioral health services. And so then Medicaid becomes an issue for Heather's teams, because they're serving those child welfare kids, but child welfare kids that are in that can't bill Medicaid. So for what she does with her staff, Medicaid isn't going to be helpful.
All right, and then on page 7, we do have 2 positions that are we're asking to be converted from project positions. One's a full-time position and the other is a 50% position. And what this is when we went into shelter care to do it, we thought we could run with just one staff person on 3rd shift. And that's not safe or possible. So we have 2 staff people, and it's been a project position. We want to make that a permanent position so that at any time in the facility, there's at least 2 staff people present. So that's what that is.
And there was, there's a little bit of net cost to both of those.
Yeah. And we are also, and for those on the board, you may see it, may hear it, I don't know how that all plays out, but we are adding youth in front of the titles for shelter care. So there's shelter care specialists and there's care advocate specialists that are over there. And we're changing that to shelter care specialist and youth care advocate specialist, just to make it clear when people are applying and looking on Indeed and those kinds of things, that these are youth positions. Some people, the way technology is nowadays, they just put in a keyword and that's what pops up. So we want to make sure our titles go with technology. So any other questions related to child welfare?
Thank you. I have a question about kinship care. I know that we're making an effort to place more kids with like kin. And with that, I imagine, does that come with increased costs to the county at all, or it decreases costs?
I guess it probably is fairly even. So in terms of payment to the kinship provider, that is all, that's 100% the same. So if they, they get a higher payment, we have more kids that are placed in a kinship home, we get reimbursed from the state for that, for those placements. So if we have 100 kids, we get reimbursed for 100 kids. If we have 150 kids, we get reimbursed for 150 kids. The piece that may cost us a little bit is if they need additional support. So we have asked the state to fund, to give us money to be able to support those kinship homes. That hasn't been approved yet. But some homes, in order to keep that kiddo with their family, we may need to help them out with certain things. And so that may be some additional costs. But what I would say to you is if they were in a foster home, we'd also have those costs. Yeah. So that's, basically for us, we say that a lot, like the placement itself has a cost, but then our support to them is how we keep them in that placement and not have to move up in a level of care.
Yeah, and so my next question has to do with that support. I was listening to a public radio show one day while I was driving about kinship care, and the guest was talking about how it was great for her to be placed with like kin, but she was also talking about the struggles that placed on the family and the things that she probably went without. And one of those was access to health insurance, medical insurance, and dental care. And so are those things, and it wasn't in Wisconsin, it was.
This kinship, they get medical assistance.
Okay, I just wanted to make sure that the child is provided for, so their basic needs can be met.
Yes. Yes.
Insurance as a whole. Yes. Different ballgame.
Yes.
Okay.
And and I'm looking for it right now and I can't find it real quick, but we have a consumer program expenses line, which is on here 56. That's a line that we use to support families. And it doesn't matter where they're at home, in kinship, foster care, wherever, we do that to support that youth, that child, and the family so that they can provide for them.
All right, thank you.
We certainly do not want anybody to go without.
Question, Becky.
Anything else? All right, thanks.
Okay, I think I'm next. I also think I probably have the shortest amount to say. I'm not asking for new positions, and I did hear, and Janet had some of it in here before, I think for unwinding funds were our increase you were looking at probably. Yes, okay. And I did just hear on Friday that for the budget, it was approved to have base and fraud funding increase for next year, but we know no details yet. Because that'll first get divided amongst the 10 consortia and then the 9 counties within our consortium, and that's when we'll get our total. But So we finally had a base funding increase, which has been forever. The decreases are reducing to the community agencies, which my staff didn't touch those directly, but they were in my budget, so we won't see any difference really for that. And then for.
I'm sorry, I don't,
Go ahead.
could you clarify what that means? I don't understand what you just said means for the big picture.
For the community agencies?
Yeah.
Okay, so there were some grants that were given to community agencies that the county executive was wanting us to provide to these agencies during the pandemic or for various reasons. So it wasn't anything my staff was directly involved in, it was in my budget.
Okay. Your budget was picked as the placeholder for those.
That's my, yes,
Mhm.
I want to say it correctly.
Yep.
So it's not like I'm laying anybody off to make this cut or anything like that. Okay. Other questions on that?
Can you tell us about where they were to?
So one was partnership healthcare, that's the bottom one. The other ones were they, was that the pantries last year?
Pantries, yep.
Day by day.
Day by day warming shelter,
Red Cross.
pillars. 11?
11.
The biggest one was, we had 50,000 for partnership community health. And I've talked with their director last year about the possibility of this money going away, not this year because they were fine this year, but going away in 24. And I had asked what they were using the money for, and they said that they were using it for additional advertising and sort of if they were doing an additional training or something like that. So it wasn't going directly for
Services provided.
service specific stuff. And so with that, I said, again, it's likely that in 24, the money is going to go away. So I'm in the process right now. I actually sent her an email last week and it bounced back to me. So I have the wrong email address. So as soon as I get the right one, I will make sure again that she's advised that this is our, because it hasn't happened yet, because we haven't approved the entire budget. I said, this is, it's subject to the county board approving it or not approving it, but we're going to recommend, taking it out for 24. That was the largest one. These other grants that were just mentioned are, 5,000, 10,000 a piece. They're just sort of a token amount to these agencies to say we're participating with you in some regard, but now we're needing to remove them because they are grants and they should be for specific services. And if we have a need for specific services from any of these agencies over time and they request that, then we'll consider putting it in our budget on a case specific basis. So it's not that we'll never work with them. It's just that we're going to stop just doing a kind of what amounts to a general donation, which is not something that as a county we're supposed to be doing. So we're just going to end them. And that's kind of the long and short of it. But the largest one was partnership, which was 50. And she's aware of it. So.
Other questions on that?
Anything else?
And again, for staff, we will have overtime. I've been budgeting the overtime the last few years, but now that the unwinding has finally started, we're starting to use the overtime. And I think we shared here, but the consortium, we have our 9 counties banded together and we have hired a project position that's on a Winnebago person right now, but sharing the cost with the 9 counties. So if that is successful, after that hits its 2 years, I may come back and say, we'd like to put it on the TO, but here's how it's being funded. But so that's where we're at with staffing right now.
So Anne's budget is pretty flat.
Yeah.
No new positions, pretty much steady as she goes.
Thank you.
Long-term care, huh?
Yeah, usually with long-term support, I don't feel like I have a lot to say, but this year's different. This is very different. Yeah. So as Bill mentioned, there's changes in the children's long-term support world. So that's while we support families who have a child with a physical, developmental disability or severe emotional disturbance. So that's what that program is. And with children's long-term support, you'll see that there's quite a bit of additional revenue. And as Bill also mentioned, we are not able to have a waiting list for that service. It's considered like a mandated service. So the number of kids that we're serving has grown exponentially. That big amount of increase is because of the staff to some degree. Right now, their LSS gets the money directly from the state, so it doesn't run through us. So it'll run through us when they become our staff. And then again, the number of children that we're serving and the costs for service plan per child and family is going up. So that's why that's a big amount of revenue.
And just another piece to that for everybody to know is that, again, the state has decided that this service is a mandate that needs to be funded 100%. So literally, and this is like very strange in the part of the state, they're literally saying, you serve all children and whatever it takes to serve them, we will cover your costs 100%. Now, this does not exist in most of the other areas of human services, but the way in which the state is approaching this is we have a mandate, the feds are watching this, so we're paying 100% of the costs. And so, because I've asked Beth multiple times now to remind me, like, are they going to cover all of these expenses? All of the expenses related to the staff, all the expenses related to the cost of having those staff for an unlimited amount of children. They are going to continue to do this at 100%, and Beth's answer is yes. This is what they're going to do. So it is a big expense add to our budget, but it is something that the state's saying it's 100%. And I don't see them backing off of that other than, and this is my concern maybe years down the road, is that what happened to us in the adult system is that we were doing this kind of the same way for adults, and then it changed to managed care. It changed to the family care entities. So I would say if there's a danger of anything happening down the road, it might be that they'll go from, oh, we're running it now, maybe we want a private entity to run it in a managed care way. And we will then consider what would happen if that takes place, because I'm saying big if, but if that would take place, then we would work on a transition from us to the new managed care world, if that's what they're going to do with this. But there's Beth is saying there's no indication from anybody at the state level that that is their plan. So right now, they want counties to run it and they want to pay 100% of the cost. So just to give you a context of why Beth is like, she's got the vast majority of these new positions, where are they coming from and why are they happening is a very different scenario than a lot of these other examples of cases that we're bringing to you today, where we had to make up the difference here and make up the difference there and figure it out. These are like 100%. So just kind of give you a context, because I know the county board members are like, ooh, it's a lot of new positions, and how are you going to pay for that? And are you sure you're going to get paid for that? Well, that's what we're being told right now. And
is this a relatively recent?
It's relatively recent that they've required us to cover all kids all at once. For years, they allowed us to do the service, but to have a wait list when we didn't have enough money. So there would be hundreds of kids on a wait list. Mm-hmm. And so at some point, the feds, I think, came to Wisconsin and said, you can't have a wait list. If you're going to run this service, you have to serve everybody as they come in right now. And in order to do that, you have to be able to gear up at a moment's notice with new staff and new service array. And the only way you can do that is to guarantee 100% of the funding. Because that's not something counties can just gear up for and pay for. You guys would all be having a heart attack right now if the answer was, yeah, you have to gear up for all these new kids, and then we're not going to give you any money to do that. You'd be like, whoa, 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 you know, the levy's going to go through the roof. Yes, well, the state costs are going theoretically through the roof. And that's where there's a little caution, like how long can the state put up with their costs going up? But this is happening in every county. Every director that I talk to goes, the two areas that are going totally exponentially expanding. One is the children's long-term support area. that Beth runs, and the other is the comprehensive community service area of behavioral health. So that would be Heather's area. But we have been gearing up for CCS for quite a while, so I don't think that we have quite the shock on the behavioral health side. But we do have it on the long-term support side. So that's more so Beth, I interrupted you, but more context for the board here so they understand, like, why is this happening?
So back in the olden days, if we had positions that were fully funded by a program like this, there was a sunset clause in the position too, that it would be, if the funding was not available, it was on the table of organization temporarily, basically. Is that the same scenario that you're asking?
Well, this one doesn't have an end date, so it's like, I don't know that, and I don't think that the county has required that if the money goes away, the position goes away. If the money goes away, literally, we will have no funding for them. So yes, we will have to do what we need to do in order to trim the costs. But the only scenario that I see possibly on somewhere down the road, 5, 10, 15, 20 years down the road, is maybe it goes from the county to a private entity under managed care. But nobody's talking about that. So there's no talk about that. So right now we have to gear up we have to serve these kids. We have to serve them now. And Beth said, in order for me to serve them now, this is what I need to have in place to do that.
And as far as the uniqueness of it being truly 100% funded, it's been a little bit of a transformation. It was, there was a point in time where we had to spend up to 40% of the position, and it's trickled down. And then they said they were reimbursing us for everything, but we were still spending, I don't know, $1,500-ish. And now they are literally saying any and every expense you have related to supporting this program is truly reimbursable. And that was verified at the end of 2022. The counties were made whole. Like Bill said, if things change, kind of the worst case scenario would be a family care for children. We had years of notice for that wasn't you're becoming a family care system next year. It was years of pilot project and planning. And right now, because every county, as Bill said, is in the state is experiencing that, there's no way the state could say, we're cutting back the funding, or you have to pay more. The counties would just say, sorry, we're not doing it then. And they would be in trouble with the federal government. So could there be a change in the future? Sure, but we would have quite a bit of notice, and we don't know what that change would look like. The precursor to family care was looking at how we allocated funds, and I would actually like to see that change, but that would probably be one of the first things that would change, would be just how we determine what a family can receive. So so that's a big increase in revenue. There's a decrease in COVID revenue, so we had received some additional money, ARPA money and whatnot, through our Title III Older Americans Act funding, and that's going away. Some of it will be partial in next year, but it's not fully funded as or not the amount of funding that we've received in the past couple of years. Same for elder abuse. We had an increase in that we will be going away as well. So there's just some additional funds that we had received during COVID, the peak of COVID, to help us operational a lot of our Older Americans Act and older adults funding programs that will not be in our budget. Other transfers in, so that is, as you probably are aware of, we have a HELP program. It's a new housing stability program, and that grant will go through the end of next year. So we will be continuing to operationalize that grant, and that will be additional funding for that grant due to keeping it operationalized through the end of next year. And then related to that, we have some emergency rental assistance funding, and that's gone for different things where a person's got we don't just say a person's homeless and we provide rental assistance. That's not how it works. It's very, very scrutinized as to who we can provide some type of rental assistance for, how, when, and why. So it could be that there's a temporary gap where they just need a couple weeks payment until they get such and such changes. We've got people who've come to us because they lost their employment and they're now at the point of being evicted unless they make a payment, but they've got a new job, they just haven't been paid yet. So we need to get them out of the rears to get them so that they can stay in their housing stable. We know that they're employed, it won't continue. So there's a lot of unique situations that would warrant us paying a temporary amount of rental assistance. So that was on page 6. You flip it over to page 7. I can tell you a little bit more about the positions that we're looking at adding. The first one for long-term support is an administrative staff to help us with the HELP program. So the homelessness, eviction, and loss prevention program, again, is a housing stability program. And we have not really advertised it yet. Part of the importance of the program is letting people know to come to us before you're evicted and before your house is foreclosed on. You may not have seen a lot of this in the community because we have been scrambling to just deal with the referrals we've had without doing that advertising. So then we had a staff go on maternity leave who's still out on leave, and we're barely swimming. And so when she comes back from her maternity leave, we will be advertising this program. The school districts are chomping at the bit to be able to make referrals to us. And we've got a lot of community partners who are saying, can we refer? Well, sure, we'll take your referral, but we aren't, again, advertising that we're available to help people yet. Once we do that, we're going to need some additional support. So this administrative staff will help us with operationalizing that program through the end of next year. And we're actually going to be hiring for that this fall, but it'll be part of next year's budget. The supervisor for CLTS is currently a project position. CLTS, Children's Long-Term Support World, has grown so exponentially that we can't have one supervisor. Many of our programs, as Heather mentioned, you know, like the Children's Community Comprehensive Services, most of Annette's programs with youth justice and child protective services, those kind of services have 2 teams, one in Neenah, one in Oshkosh, and it's because of the size of the program. So we've only had 1 children's long-term supports team, and now we have 2. The current project position is supervising our within social services LSS program that's contracted. Next, we have a lead staff, and that's a person who works with LSS right now. We don't want to rock the boat with any of this programming. We have a lead staff within DHS for children's long-term support. We would maintain the lead staff through LSS. And then the 12 staff would be, as Bill mentioned, bringing those contracted positions in. Some of the reason for doing that is it's become way too hard to coordinate. When we had a few service coordinators that we contracted with, no problem. You'd think that they were regular staff anyway. And as the program has continued to grow, we now have 3 different locations, which is hard to manage. The onboarding for staff has become incredibly difficult, believe it or not, way more difficult than the county. They bill for their service at a much higher rate, but pay their staff much less because there's a whole bunch of administration there. And so it's more costly, but the staff make less money. So when we have an opening, they jump over to us because they don't make as much money. They're doing the exact same thing our staff are, and that's just not fair to expect them to do the same exact servicing at a much smaller pay. So this is really in their best interest. If for some reason someone decides, no, I like LSS, I'm okay with the less pay, I'm okay with the less benefits, I want to continue to work here, they have that option. They will still continue to provide contracted case management for other counties, including Outagamie, and they have the choice of staying. So we're not forcing this to happen. And I'm trying to answer some of the questions that were brought up earlier. Hopefully I'm covering all of them. And then lastly, we are adding a new position because, and this gets really complicated, but our provider network has also grown. We have probably close to twice as many providers since this all started, not quite. To bring a provider on is very complicated because they get billed through a different third-party administration, and they have to meet certain state requirements, and they have to go on a registry. We have to do all of our contracting. And some of these providers are like a karate club who has never done a contract with anybody before, much less all the processes that are involved. So when a family identifies a service that would help their child and they want us to authorize payment for us, it's taking us a very long time, which gets the family, the state says we have to have services in place within, sorry to laugh, 15 days of the request. We can't do that. But it is a long process, and it's taking an inordinate amount of time from myself and the supervisor to get all these providers on board and do the contracting process. And then, to be perfectly honest, our quality assurance with our providers is much more limited because we don't have the infrastructure to assure that these providers are meeting our contractual requirements. So we have a position who will be a social work specialist. That person will be fully trained as a waiver staff, so they understand all the CPT, SPC acronym world crazy stuff and can relate it to these providers and do exactly what we're looking for to manage this. So we used to have a position like that in our waiver world, adult waiver world. And when that adult service waivers went away, so did that position. Well, now we're mimicking it in the children's world where it would be similar to the position that we had. Any questions so far? Good.
Yes, thank you.
Yeah, go ahead.
These positions, will all of them be need to be added to the table of organization?
Yes, they will. I don't know that we will hire all of them January 1st. We will hire for what we know we need January 1st, but with the continuing growth of the program, that's the number we project we will need conservatively by the end of the year. We may need more than that, but that's what we anticipate we will need in 2024.
Okay, so I'm adding to the table of organization needs action by the county board, correct?
So in the budget process, every department
Oh, but this
submits
is
a budget with their table of organization changes,
Yep.
sometimes up, sometimes down, and then you pass that at the same time.
You still got to approve it, yeah.
Okay,
It's not
so
separate.
thank you for reminding me of that. I, of course, trust you and understand what you're doing. However, we may need to communicate a justification for at least 15 positions.
Yep.
To the county board as part of that budget process.
Yeah, and
So what sort of data and information have you used to justify the addition of these positions?
so how I and Renee and Janet will do that in October is basically what I think we do here, which is to explain, here's this program, and why it requires us to serve everybody right now, and how we had been doing that essentially through contracts. And now, because of the need to have not half of our staff be doing it and another half doing it, how we want to bring them all in. So I would just describe it that way, and to say it's not more costly to do it because all of it is covered. The expense is all covered by the state.
However, from a taxpayer standpoint, which I think that the county board is, very conscientious of simply looking at public dollars and taxpayer dollars, even though it doesn't cost us literally a dime to do it, from a taxpayer standpoint, it costs the state more for us to contract out for this. Because again, they charge more per hour than we do.
Yep.
So I, as a taxpayer, don't like the fact that we're paying more than we need to for staff who are making less. The administration of doing it contracted is a higher cost to the state and a disadvantage, which is why we keep having a revolving door at LSS. They can't keep staff. So it's hitting our program, and even though we're required to not have a waiting list, we've had a waiting list for a matter of months now. We're just now addressing some families that came to us in May. We can't keep up because they can't keep up with hiring because the pay is less. So I think it's important to not only emphasize that there's a $0 to us, but from a overall public dollar standpoint, we are saving money and treating staff better.
Well,
That's really important.
we're saving money and providing a better service
Exactly.
to our community.
We're better serving staff and we're better serving families. And so there's a lot of advocacy going on at the state right now for children, and if anything, it's going further in the direction of, we want this at this point in time, and now the state's gonna start posting what kind of a wait list every county has, because we've got families saying it's not fair, that you said we don't have to wait, you're making us wait. Well, we can't keep up with that with this contracting method, so,
We'll have Beth with us.
Yeah.
Yeah, it is a lot to comprehend because it's a lot of new positions. And the, question why so many all at once is, it's not easily understood because you're thinking we're going from nothing to adding 20 some staff and it ends up with, well, we're already doing the service, we're just doing it a different way. And
Yeah.
right, it's gonna be more cost effective and a better service coming from us.
We're not able to effectively serve our families right now.
correct.
And by doing this, we'll be saving taxpayer money and servicing our families.
Exactly. Yeah, we've been band-aiding it together through a contract, and given the size of the growth, that's not sufficient. The other thing is, this is a savings, though I can't tell you a dollar amount to our own budget, because as Annette can attest to, they have families who are eligible for this service and need some type of respite or something. And when there's that waiting period, could be 2 months between when the family is in need and we are able to onboard them and get them the services they need, guess who's paying for it? And their staff remind us of that regularly, because unfortunately it's coming out of levy when we can't onboard kids quick enough. So there is an actual cost to our county of not being able to do things the way we are supposed to be doing them. So it's a savings to the state, it's a savings to the county. Short answer.
Yes, and I just had one more thought that
Good.
came back and left again. I'll see if it comes back.
Okay.
Thank you.
So what you're saying is, just overall, sometimes you find it's a better process to contract services, and sometimes you find it's not, and in this situation, it's not, to better, to
I think
maximize
whatever we
the
don't know, the general tendency is for us to contract.
to get a feel for it.
So that we can get it tiptoe into the water, find out where the costs are, find out what's happening, find out if we need it. And then once we realize that, okay, it's working, it's a good service, but maybe now, like Beth found out, one of the things that makes sense to me is if our contractors are charging us, lots of money and they're paying their folks, a limited amount, they're gonna struggle with getting people, which is only gonna make our costs go up because we have to do something then when they can't get their own, just like what we did with the shelter care. When they couldn't really run the shelter care, it was still costing us money. And so by having our own staff, now we control, hopefully better, the ability to have staff there to control our costs and to have a better service. So, but in most cases, we start with a contract and then in some cases we move it in-house later on.
And this program grew so much.
Yeah.
You had to take some action.
Yeah, it was manageable initially.
Yeah.
But it's gotten to be so big that we can't continue to do this.
Can you just talk about what that part of it looks like the increase in demand and
Like, how big is the wait list?
Sure.
Or how big has it been?
So when I was in the supervisory position for this, 5 or 6 years ago, we have 3 times the number of kids. So it went from about 200 something to 600 something. So really, and it's continuing to grow. We're not talking a small percentage, we're talking about a 200, 300% growth. So that's to give you an idea of the growth of the program. With the waiting list, so the state has put a lot more requirements on how to operationalize this program. It's become incredibly complicated, very complex, but one of the many requirements they have is that if a kid moves here from another county, we have to serve them within 30 days. And we have to move them up above our wait list from people from our own county. So probably monthly, we get, that Outagamie County, Winnebago County border, we got people moving across the street and down the road regularly. So part of our problem is that we have to take those kids first. But right now, like I said, the 2 months would be an extreme. It's more like a little over a month to get a kid on board. But if they're from another county, we do it a lot quicker than that. And then if there's an absolute crisis situation where there's a family in need, they're not child welfare, they're not eligible for CCS, we have an ability to prioritize those families. So I don't want to paint the picture that there's families out there really struggling, they can't get anything, and oh my gosh, this is, a borderline abuse or something. That's not the case. We can prioritize those families. We also have the ability to refer them to some other kind of temporary resources. The Respite Care Association of Wisconsin can give funding when we can't. It's not a big amount of money. It's not a long-term solution, but we are able to hook them up with community resources such as that, Boys and Girls Club, different resources that they can manage until we can get them off our wait list.
So at any given time, you said it went from 200 to 600. At any given time, how many kids do you think are just on average? We know about, we need to get them in, but they're not in yet. What would you say that is? Or what's it gone from? Like
I'm gonna say 20. It varies, the number I give you today and the number I give you tomorrow are two different numbers. It really truly varies. It could be 12, could be 25.
It was hundreds back less than 10 years ago, right?
Yeah.
That we had, and Beth was always trying to get more kids on faster. I mean, it was like, she would come to me every year with, we got to do faster. It's like, well, and I'd say, can we still have a wait list? And at that point, she'd say, yeah, we can still have one, but we don't want to have one. It's like, yeah, but we have to, the standard issues around wait lists, and in this case now, there is no hundreds. You can't have hundreds of kids on a wait list. You can have some of these transitional kids that at any given time are about 20, but they keep coming, right? The 20 never goes away. It's just like, it's always there.
We keep thinking at some point the referrals are gonna plateau.
Yeah, when is the referral gonna plateau?
But I don't see it in the near future because they keep changing things to increase eligibility for kids. From now, they started something where if a child is applying for Katie Beckett, which is a form of Medicaid, and if they're applying for Katie Beckett, they are an automatic referral to us. Whether they need services or not, it is an automatic. The day they apply for Katie Beckett, the 45-day timeline for us to get them on board starts. That's new. Now we're starting a no wrong door program for the state, which is, children with special health care needs is going to be operationalizing a program called No Wrong Door, where any family in the state with any need for a kid, wide open, would go through this program. And if it's identified that the child has some type of a disability, it's a referral to us. So I don't see this going down at all in the near future.
Yeah, so you can see where we're kind of in a rock and a hard place, and we have to have the number of staff that we have to have. We could continue to contract with LSS. They obviously they'd prefer that we do, but we're just getting to the point where, it's hard to manage. Half of your staff are not your staff. They're in a provider agency, and yet we're supposed to be doing the same service quality wise and quantity wise. And how do we maintain, here's what we do, but here's what they do, but we're supposed to do the same thing. And it just gets harder and harder and harder unless you just have them all under you.
Especially when they're located offsite too.
Yeah.
But as you keep having 20 kids come, in the pipeline, are there 20 other kids coming out of the?
Nobody's going out, they're all just coming in.
Long term.
And until we hit the
Yeah,
plateau,
long-term.
we will keep adding what we need to.
The LLS folks are off.
They are located in an office setting in Appleton where they don't even have enough space for them. So they're having to walk through another person's office to get to a small work area. They're having to increase remote abilities because they don't have enough office space.
And they serve our kids in Winnebago County, and doesn't mean that they're not going every day to those homes, but they have to have some interaction in those homes. So we think that even if, and again, the next question is gonna be space.
I was
which,
gonna say, do we have space for them?
So we are let me just put it this way, we are investigating all county spaces, not just our spaces, but any county spaces. And if we can't find county space, then Beth is looking externally to private space in the community. And we are assured also that if we have to go to private space in the community, then we can get those costs covered as well. So if we have to rent offices in Neenah, or wherever we decide we need space, then we can rent it and we can get our costs covered.
And whether it's county space or offsite space, wherever we end up having to look at more space, we are assured that we can build that entire 100% cost into our case management rate.
Including setting up the workspace and providing everybody with the necessary technology and
Yep.
all of it.
One of Janet's staff contacted the state to assure that before we pull the trigger on doing anything, that's covered, and they did assure us that.
That all adds up, computer software.
We've heard it from other counties, but we wanted to hear directly from the state that everything's covered, and they said, yes, whatever you have to do.
So we're gonna try county space first. We still have some, and we don't really wanna say where, because facilities is kind of assisting us and trying to figure out, is there actual space in the county somewhere? But short of that, if there isn't, then we have to look externally, because we don't have enough literal offices here or Neenah to be able to handle that additional staff. So we literally might need to have a portion of people work at another location that we will rent in the community. But we haven't got there yet.
And then jumping to page 17 really quickly, I'll just highlight a couple things in case there's any questions on that page. Item number 2, I think we've kind of covered everything that I could possibly regarding the state covering 100%, which is the increase in that number. With number 3, we did just hear that there was additional funding approved at the state level in the governor's budget for ADRCs, but we haven't been told how much. So the number that's in here is what we know. That number will go up. We just don't know the dollar amount. Line item number 6 is transportation, specialized transportation. And the increase that you see there is based on what was in the governor's budget. We don't know whether the state's going to, there's a percentage of increase in the governor's budget. We don't know whether the state's going to take a chunk out of that or not, because sometimes when the state approves an increase, the state takes a piece of it and then gives the rest to counties. But this is what was just approved very recently, just a change. Line item 15 has to do with pre-COVID and the nutritional program, congregate and home delivered. It's Title III, C1 and 2, and those items have flip-flopped a lot back and forth because meal sites were closed. So we did more home delivered meals, and then we opened up meal sites, but some of them can't be fully open and they're grab and go meals. So those items flop back and forth. And I don't know if we'll ever get up to where we were with meal sites. According to some of my counterparts in other counties, they just aren't back to where they were with meal site attendance. Number 20 is just more people are on MA than there were before, which increases that revenue. We've talked about staff under the expenses. Line item 45 with automobile allowance increase is because during COVID, we could get verbal signatures and electronic signatures. Now we have to meet with a person to get signatures. So some of those people come to our office, but we often have to go out to homes. We didn't have to do functional screens to maintain kids on the children's long-term support. We now have to go into their homes, meet with them and do a functional screen. We were doing some of that stuff, but a lot of families during COVID were saying, nope, I don't want you in our home. Now it's a requirement of the program again. So pre-COVID or during COVID, we didn't have as much travel, but I anticipate quite a bit more travel. And then the other big one was line item 53, Some of that has to do with printing associated with our help program. So we're printing out all of the brochures for that and documents for that. What we're doing with help, which is a lot of those top items, is we are helping other divisions within the department to maintain housing stability. So there's a cost to us doing all of that. We have a newsletter that has some printing associated with it. We try and do it electronically. You guys on the board get our ADRC newsletter. So we've had some increased printing and copying. And that's the big differences that you'll see on the LTS budget. Any other questions?
You mentioned the funds to advocate and congregate meal settings.
Mhm.
So if there were groups getting or people getting funds from Winnebago County for congregate meal sites, those will continue?
Yes, it will continue. AdvoCap has already submitted what they project it will cost for next year, and we are able to meet what they have requested. Sometimes we do a little haggling back and forth to figure out how we can meet adults, older adults' nutritional needs and stay within a reasonable budget, but we are able to accommodate their request. And like I said, some of it has been, a newer thing has been this grab and go concept. So there's a couple of housing authority buildings that have been dealing with bed bugs for probably close to 6 months. And there are people in those facilities who need the nutritional meals that we offer. And they can't go to a congregate site there. So what they do is there's meals prepared and they get them in a bag and they take them back to their room. So that might continue because it's increased participation, and I'm trying to assure that our older adults are getting proper nutrition on a regular basis. So I'm not concerned at all with us meeting the needs for our nutrition program.
So that's,
Anything else?
that's.
Not specific to LTS, but I wanted to mention to you all that, so on page 7, where you see all of our, the new positions, other than LTS's admin person, because for the help program, these are all positions we already have. As you see, there's a lot of them are being converted from project to regular positions. I want to mention that even though, July 17th, we're having our budget today, this won't be news to you. We have other needs. We have other services that we're either already doing or we have identified as a need. We really should be doing the service, or a wish list, if you will. For example, in child welfare, as you know, we've assumed shelter care. The family services contract is kind of iffy now with the Silvercrest group home, which is going tomorrow night before the board. The contract itself, meaning if that provider is going to continue, what will that mean for us? My point is the growth of child welfare in a very short amount of time. So most of the times when we add positions, we're talking about direct service, our folks that go out and either staff the facilities or meet with our people, whether they come here or whether they go to the homes. What it doesn't usually account for is our managerial time, our admin time, our support time. My point is that as the services themselves expand, it also taxes the people behind the scenes, right? Our supervisors, our managers, our admin support, and you rarely see that here, right? Because we're trying to get the service in. So I only preface it here today is what we heard from our county exec is, yes, come to me in the fall, with your budgets. And if you have other needs, you bring them up. I mean, no guarantee, but in full transparency, if there should be something else before this wraps up, I wouldn't want you all to be like, well, you didn't say anything at the board, at our board meeting. So just that's always there. We don't talk about it very much, but it's that extra burden, I should say, of our growth. Our growth is wonderful. Bill and I often say, the managers often say, like, I wish we could do everything. I wish we could be the end all for everyone. Obviously we can't. Like the co-responder, were needs at the co-responder division embedded with Oshkosh Police Department. That request initiated from OPD, like we have other needs here. And we think we can partner and do something, and we are doing some really cool stuff. The Connect stuff, that needs was identified by the DA at that time. We have other needs here, and we think we can partner with Human Services and do some really cool stuff. And we are. You've heard Brian Defferdine talk about mental health court. That's still pending out there. You don't see any of it here, but my point is constantly people are like, we have needs and we want to partner with Human Services to meet the needs. Really cool stuff. What often gets overlooked, we have needs too. Internally, we've identified, we need this, we need that, we could be doing this, if only we had that, blah, blah, blah. And often that isn't what makes the budget. So
I'm glad you emphasized that because I mentioned ADRC, an increase of the state. We, with aging demographics in particular, and a lot of people coming from other counties, we've gone from a same day response to up to 2 days. And the supervisor for that program already has 13 staff. And I don't know that we have any other supervisor with 13 staff right now.
Oh, yeah,
So, but I mean, I'm just saying that's a lot of staff for one person. And so even if there's funding from the state, it's like, well, how do you fill that gap? So I'm glad that you emphasize that things do change and needs continue to grow, and we need to stretch ourselves to try and accommodate, which means
another way to say it is that we're going to continue to have discussions with the county exec after this point, and especially this year where we don't really know totally what the expectations are going into our August meeting with the exec. But if between now and then we can formalize maybe another couple of asks on the side where we can say, hey, and if you're willing to fund us with a couple of other positions, here's our priority list for a couple of other ones. It's too premature for us to tell you this is what we want on the list, because we're not ready today to say what would be. I'm sure every manager in here will tell you, okay, if you're gonna start telling me what I need, they'll have a list of probably anywhere from 1 to 5 different ideas of things that they want to add to their particular department. But that wasn't the requirement that we were kind of given to budget with. But if we get that opportunity, what I think Renee is saying is that we may be able to advocate for an additional position here or there that maybe the county exec would say, yeah, put it in my budget, and that you may see in October and you're like, we didn't talk about that, back in July. And the answer is, yeah, because we weren't ready to talk about it yet. We didn't have it put together. We didn't figure out how we were going to pay for it or how we we're going to make a case for it. But just know that if it looks a little bit different than this, it wasn't that we were trying to keep it from you. It was that we weren't ready with the ask, and maybe it kind of comes together in late August, early September with the county exec, who says, maybe I want more mental health for the community. Therefore, Heather, come up with, another position or two that's going to fill that void, and then it gets put into his budget. So that's where it comes from. So just so you know, we're not trying to keep something from you. We're just basically trying to go in with what we were told to do. Then we have a greater discussion at the end of August, September with the county exec, which then comes to you back in October, where you can ask us more questions ahead of time, which is fine. Ask us, tell us, did anything change? And I will tell you whether it did or it didn't come the end of September.
So Renee, I'm sorry. What I heard was an increased need for administrative positions to support staff. And it could go 2 ways. It could go by division or it could be administration. Last year we said when we met to do the budget, you need another cut band, right? It looks like you need another person. So if you can put together something for us to look at, I think the board would support you with that. Because it's not, paperwork isn't getting less and less. Reporting isn't getting less and less.
Yeah, like Bill said, I mean, if you asked every manager sitting here, they'd probably go, yeah, I got a list for you. Well, I can give you a list. But again, it's how how much, we have to be reasonable with it too. I mean, you look at page 7 and like to your point earlier, Becky, people who don't really understand might be like, what are you doing there? Right, so to say, well, oh, by the way, we need 2 more supervisors and 2 more admins, you know, most folks wanna see the service at work, right? I'm talking about like the taxpayers, like, where's my money going? Are you providing the service? And often what gets overlooked is there's more, the infrastructure, there's more to it than that. We have soups with high caseloads. Annette is still the only manager in a division of 100 and some people. You may know we brought Tammy on last year. Tammy is a part-time manager, still has direct reports herself. My point is, we've got these 2 very large divisions. Beth's division is growing exponentially at the moment. The very large growth, and Bill gets, not that he gets tired of it, but he's like, I know, Renee, I know, you're being logical. But it's hard, those positions are harder to sell. That's what I'm saying.
And we're already looking at a list. I mean, from the standpoint of department head, so we're already looking at a big list of new positions. And so it's just as Becky pointed out, making sure that we justify the positions that we have already on there. And if we get an opportunity with John and with the budget team that's putting stuff together at the county exec level, we're gonna interject what else we need. We're basically going to do that. And then maybe something more comes of that. And if it does, we'll support it, and then we'll talk to you guys about it and let you know that we were able to add something else. And but that's how it works. You know, it's your stage now where you're hearing about what our proposal is, what our directives were for the county exec. It is your budget to tell the county exec what it is that you want done with the budget at this moment in time. And as all you know, it's a moment in time, because then it goes to him, and it's then his budget after that. So it is wonky, and it is a weird statutory requirement that you all have to do this kind of ahead of the whole budget, but that's how it works. Yes.
Yeah. So when you're presenting this, so we're looking at 20 plus, just a little over 20 and a half new positions. So rather than pick out every single one of them, if you were to present, we need 20 new positions across the whole department. And this is how many people, how many consumers needed. So we have this many dozens and dozens of, you know, whatever the number is. It would seem like that would be an easy thing to grasp. Okay, we have this many people needing help. No wonder we need 20 positions to cover it. Is that a possibility to just list in the past 12 months, or pick a time? This is how many came to us looking for
Number
support?
of consumers we actually serve.
Yes.
Yeah, we've
And I don't think
We
they
have that
necessarily
data.
have to be, is it called individual consumers? I mean, even if they're needed for different things, they can be counted possibly twice, because they need this and they also need this. And so I think just saying, here's the number of people needing services. This is why we need 20 new positions.
Except that they're not completely new positions.
Yeah, they're already positions we have.
Existing positions that are being.
Yeah, just about every one of them is existing.
There's only one position, I think that's actually you, isn't it?
They were contracted positions, and now we're making them county positions.
Somewhere on a different
Otherwise,
status.
it's a 20 that from nothing versus 20 transitions, I think sounds different.
Yeah, that's a good point. We should emphasize that as well, just emphasizing that.
Or whatever the number
These
is.
positions, other than the administrative associate on page 7.
Yeah,
are
already there.
Already there,
Already
already doing
there.
the work.
But you could emphasize it by saying those existing positions are serving over 600 children with disabilities, or, you know, we could throw numbers at it too.
But that's what I mean. It looks like new, you know, here's your new growth and here's how you're handling it. It's like, oh, we've been doing this work for some time.
I think the biggest thing is that, like Becky said, I truly don't see that these 20 and a half positions is gonna be a big sell for the county exec. It's gonna be a sell for the board. When they come in, the board is the one that we have to convince that we need these 20.
Well, that's what I'm
25
thinking.
that
If they see the masses
that already
that we-
exist. I don't think the county exec's gonna have.
I'm not worried about him either. I'm thinking when you're bringing to the board, who already doesn't understand
But like I say, I think we need to stress that, yeah, these positions already exist. I mean, well, there's only one of these 20.5 positions that's actually new. We're only asking for one additional.
And I have to make the case that the new cost is 86,000.
Yeah,
And
For
it
20
isn't- it
positions.
isn't a million,
Yeah.
it isn't 1,000,007.
Yeah,
Or 1,000,008, it's, you know.
86,000 for 20 positions, that's.
And for positions, most of these positions are already working, doing the work today,
Good
they're
job.
just not on the TO as a permanent employee of the county. And that's what we're wanting to do, is put them on a permanent employment status.
Okay.
I just want to go back to what you, Renee said, earlier. And, I guess, play a little devil's advocate and just think about things a little differently for a moment. There's the reality of the fiscal reality of county finances, right? And it's not unique to Winnebago County. And then there is simply a people shortage in Wisconsin. We don't have enough people to do the jobs that need to be done. And when you put those two realities together, it's hard for me to imagine continuing as a county to add employees over and over again. And I'm not speaking this in terms of the long-term support positions, but just generally. And as a newcomer to the county board, something that stands out to me is the continued posting of, I don't know how many jobs are posted on the county website anymore. And then when the county board says what's being done about this, we hear, well, we just don't have enough people. So you can't keep going on like that forever. So at what point does a county department or Winnebago County as a whole start to look at job positions and job descriptions, and the way things have been done for a long time, and reevaluate those descriptions and functions to see how things might be able to be done differently in a more in perhaps a more efficient manner. Like, at what point do you question how we've been doing things for forever, for how long?
Okay, I can answer that from
Yeah.
child welfare real quick. At every time that something changes or we're at a new budget, I have evaluated with like my supervisor team, it's a team of 10, of how can we use a position differently? When we opened up shelter care, I moved 2 social worker positions there. So took them from a team and put them there to try to save some dollars, which now is kind of biting me in the behind because things are going up. But it's just every time we're looking to see how could we use this differently? What could we do different? I think is really what we're trying to do. But one of the things that happens is, that turnover, child welfare certainly has had our share of that. That then adds so much to the supervisors and to me in terms of moving those people along. Kind of burns out our staff a little bit because they're taking other things. We don't have any more human resources, does not manage turnover and hiring anymore. The managers do. That's our job now. So it's just, and I get it. They're at that same boat. They didn't have very many people, so they reallotted things. So I think as a group, and I don't want to speak for all the other managers, but we are, every time we're looking at it, like try something different, how can we use our current staff to do that? What can we do to kind of finagle that? And, those kinds of things. And I hear you, that how do we fill these? But we have to serve this population. And sometimes that's with more people.
And I think it's also important to frame that conversation. Like, what are we looking for? What are we trying to accomplish? What are the values driving these decisions? Because when only the dollar signs are used, then we're missing other things. And the dollar signs can't be the only thing driving the decision.
Right, but I think we did, I think about 4 years ago, when we did our last wage and class survey, classification, they did that. They looked at every classification and says, are we doing what we're supposed to be doing? Do we need that classification? 4 years ago, we did that. We had a,
She's talking about
Class and
16 she's talking
counselor.
about 16 with,
Yeah, then 16.
yeah,
demographic.
Another thing that's not identified in this budget is the high use of interns that we have. So we are really using a lot of interns to assist us to get our jobs done.
Yeah.
And so not just looking at what we do, how we do it, and trying to be efficient as possible, but how can we give back to our learning community and benefit greatly from the work that they do for us. So again, it's not something you see on paper, but we use a lot of interns to help us get our jobs done too.
I think the scoring of PBB, once we get to it, is going to tell a little bit of a tale of like, why do we do what we do? And what do we absolutely have to do versus what it is that we like to do? Versus what it is that we like to do that also saves us a ton of money, or what we like to do that doesn't save us a ton of money, but we like it for the citizens. See all these different categories of, you know, what are we gonna do in the future? Like, what do we, and for us, most of what we do is absolutely dictated by what Madison has us sign as a contract in December. It says you will do the following list of things, and you will serve people in this way. And so therefore, I would say at least 90% of what we do, I'm just using 90, it's a general ballpark, but at least 90% of what we do is dictated by Madison.
mandate.
And maybe 10% of it is how we've chosen to do things that either are, we think, more efficient, or in some cases, somebody thought was a great idea that isn't required, but is helping another department, is helping, you know, the greater county good or whatever, and so we do it. And then those are the things that when we get to priority-based assessment of what we're doing is, okay, is there a mandate? Is it something that serves all the counties? Is it something that only serves a few of the counties? Is it something that we could do, but we could do it, but it's not required in the quantity in which we're doing it. So, and I don't want to pick on any particular departments, but let's say a department that doesn't have a state mandate to do something, and it does multiple things of that same thing, you know, that's going to be probably rated a little less high than some of the other categories. And those are the things all of you in county board are going to have to wrestle with is, what do you want to change and how do you want to change it going forward? And I think, you know, you're asking us, do we tweak the job descriptions all the time? Absolutely, we do. If we can do something a different way, if we can merge a couple of positions together, we try that. Most of the time we have specific requirements for the job. So even if, you know, a lot of counties are going to, well, maybe we don't need to have this requirement for this job, so we can open up more candidates for doing that job. We'll take a look at that too. So I think this department has done that very consistently over the years. And it's a lot of positions, but we also have the largest department in the county. And the thing I would say about that category of like, can we do this because how can we get these people on board? Most of the people on this list are already on board. They're just working in a way that isn't on a permanent status with the county. So it isn't like we got to, you know, find 20 new people to take these jobs. I mean, they're already here. They're just, you know, categorically in a different category, and we want them on a permanent status. So that's the answer I would give for, we don't have to find 20 new people in a job market that's super tight. So that's.
Yeah, and I wasn't speaking specifically to those because I get that situation.
But yeah, can we do other things? Sure. I mean, we can, and if we have to tighten our belts, we tighten our belts. And, you know, and I don't like putting everything to money either, but this is the time of year where I have to translate all the good work we do into, does it make sense financially? And that's why even this morning I'm thinking, I don't want this all to boil down to, you know, a dollar and cents thing, but at budget time, it has to boil down to a budget of a dollar and cents thing in what we're doing. And we'll advocate for whatever else we need, believe me, and I know for sure, I'm gonna get Renee here. Renee is a very good advocate for, yes, but we need this. And I know that at budget time with John, we'll be talking about some additional things, because if he wants us to do more stuff, then we gotta have more help.
Yeah, you can't keep doing it on zero,
Right.
zero, zero. But at least we can talk about almost $2 million and fight about that instead of $2,000. So that's encouraging.
Yeah, exactly.
Yeah, and that's something.
Exactly. Right, you
So-
got some extra shared revenue.
Yeah, so with the additional things that you were talking about, what is the plan for that? We won't talk about that today, but you might advocate for something with county executive.
Maybe, I mean, maybe if the conversation comes up, because right now he gave us, try to do it on the budget that you had last year, and then talk to us about maybe things that you want to do in the future. So it was kind of left open like that, as opposed to come in with a budget for the other stuff. So we're gonna talk about what other things can we do? Well, here's some other things we can do. And I'm probably gonna ask that every one of the divisions, basically, every one of us we can get the wish list of things and priorities, and we're probably not gonna go in with 20 additional things to the meeting with John, but at least a few. Say, hey, here's a couple more things that we could potentially do.
Yeah, if you could have 3 things, all of them, that would be a win, right? One of them would be a win. Because we do have a small an infusion of cash coming through shared revenue. And it presents an opportunity for investment.
But I will say to you on the
people.
county board, so because I've been in county board meetings many, many years, that the money that's coming in, the new money that's coming in has to go for law enforcement.
Yeah.
That money then that goes to law enforcement of the levy could be freed up and then could go to other departments, but there's a lot of other departments in the county. And
But do you want to be at the table?
Wait,
That's
wait,
the whole thing.
yes, and as much as I'd like to say, yes, we should get a piece of it, and I agree that we should get a piece of it. Most of the time, human services is kind of like the last thought of, because we have the most ability to move money around where a lot of departments don't have any ability to move money around. And that's what you're gonna hear a bunch. I'm just being,
No,
I mean, I'd love to say we should get our third of the new shared revenue, but chances are it's probably not gonna happen that way.
But it's important to be at the table.
Mhm.
Yes.
Right, you're right.
Yes.
And we'll advocate for a few new things.
Yeah.
I'm sure Renee's already got her list already clearly in mind.
Our services are only as good as the people who provide them. We have to take care of our people, that's what I'm saying.
And we have to have enough people to provide them.
I was just thinking you could remind them how you step to the plate with the day-by-day show.
Well, yeah, there you go.
Yeah.
And that's the way that your department functions when you need it, if you had the resources.
And we would prefer not to do that again this coming year.
Right. But Renee just has to whip out her superhero cape and
Yeah.
and
At
present.
Christmas
what-
time,
Sure.
at Christmas time.
I'm gonna be in another country, I think. over
Yes,
Christmas.
we're all planning our 2 vacations right around the Christmas holiday this year.
I just, one of the things that I keep thinking about is that I don't think a lot of people have a picture of the clients that you work with. And that, Beth, when you talk about children in need, the variety of needs that you're presented, that families need help with. And I work with somebody now who's just had a grandchild diagnosed as autistic level 4. Like the services this child will need in her lifetime to succeed is amazing. And I don't think people really grasp that until they have their hands on it, or a friend has their hands on it.
I still think there's a little bit of the typical Down syndrome kid, you think about kids with disabilities, not the kid who is destroying your house and scratching and beating you up on a daily basis. And, I think that it's not many people have that understanding.
Another one of my coworkers is taking care of her sister-in-law, who has been in a wheelchair for years and will be the rest of her life. You know, it means putting a picture with some of the supports that you provide in long-term care and child, all of the divisions that it's not done. It's not done.
I think one of the things that you mentioned, when you talked about day by day, Bill is actually the first person to be called if there's a crisis in any other department within the county. So Bill is the top
right.
call.
That's one of my newest
For
duties.
us to make
I don't know exactly what I'm gonna do when I get
That's
when I
what
get
you
a
get
call,
for
but,
being
but it'll be a learning experience.
Right, can you help us?
Is this official that you're number 2?
Number 2.
Well, it's a
Um,
crisis type situation that you're
Well, as it relates to a crisis that, again, has something to do with a
People?
crisis that has something to do with people, right? So, I mean, obviously,
What kind of crisis is there?
Yeah.
well, sometimes there's a crisis where
Building
there's
falls
an
down.
immediate person need.
All right. The building falls down on people.
Absolutely.
Well, like even during EAA, when there was the tornado and they had to have everyone go to the convention center, we were called upon to help staff, you know,
Yeah,
so.
Eric called
those are some
me during
examples.
the last EAA when there was a bad storm coming out and they needed to open up, I think they opened up the Herd
Stadium,
stadium
yeah.
for a night during a really bad thunderstorm because they were worried that some people would get flooded out of their tents or whatever at EAA. And so, yeah, so we opened up, I mean, Eric opened up the shelter and he said, Bill, I got you on standby in case we need to man it. I'm like, okay, well, we'll get there. And that is, you know, by emergency management standards, human services are the people that Red Cross and emergency government finds the shelter, but once they do, we have to run it. So, I mean, it is a big responsibility to get that done, but somebody in the county has to be responsible to not or to show up and get things done. So, and I think it was just a clarification. Heather's just talking. It was just a clarification of like who department head should call when there's an emergency that involves people that, you know, we would first contact us to let you know if we could do something to help this or whether we could help coordinate the response. So we don't always have to do the response ourselves. We just have to help facilitate coordinate. That's not a big deal. It's just another thing.
Yeah.
Just another thing.
Other duties as assigned.
Yeah. So that's it for.
So are there any other questions on any of the department stuff? Presentation?
I think the big lifting is gonna come in October when you hear of all the departments and all of their requests, and all of you on the county board have to kind of ferret through that and figure out what you're gonna do. With the new money, with the, you know, with the requests that are there at the time, so everything is really delayed. So just honestly, a lot of this stuff is very much up in the air yet until probably September, is what I'm hearing from the county exec's office. Because they don't know yet.
When do you meet with him or don't you do that process?
We are gonna be scheduled the last week of August. I think we typically meet the last Wednesday from 9 to 11, and Larry's there.
Harold's there
Generally,
sometimes.
Harold's been there sometimes. Janet and Renee and I meet with John Damo, Mike Collard, Carol Blackmore, Mark Hovick.
Yep.
And we go over kind of our part of the budget. We're usually last in the sequence because then he kind of knows what the county budget looks like, and then we end up with how much we have to do differently in order to make it all work for the county. And that's typically how it works, is that we're sort of the last.
You're the first and the last.
And that's when we usually make any recommendation of any extra stuff that we want.
Yeah, if you still got extra stuff left, then we can talk about extra stuff.
So I guess for now, I guess I need a motion to recommend this 2024 human services budget to the county exec. There's a second?
Second.
All right, then any discussion, and now we can talk about if there's anybody that wants to do any changes, any additions. Anything you want to put in, I mean, anything, any suggestions you want us to take in, or anything you want to change in it?
Except for the van, one of the vans.
This is the time. And we need that van, we didn't get it last year.
No, it's tough to get in.
Yes.
Oh, I
Yeah.
stopped to get in the
Yeah.
van.
And also, the door didn't close, like usually on those vans, you can like pull and it just closes. You had to practically get out of the van to get the door started, get back in the van. Yeah, better door, an upgrade
Yeah,
on the
push the
doors.
button.
There's no button. It's just, it doesn't have any extra features because it's for the county, so there's no extra features that we've come to expect.
All right, so I don't see any questions, additions, subtractions, anything to the budget. Then all those in favor of this budget moving on to the county exec, signify by saying aye.
Aye.
All those opposed? Ayes have it, it's been approved. Thank you.
Okay, we did order food, right?
We did.
Oh, you did.
We're a little
Yeah, lunch.
early.
Because we don't ever know how long it's gonna
Yeah.
take, and a lot of times we have a lot of questions.
time it's coming?
But
Oh,
can we
oh, it
set,
should be
can we
here.
set, talk about when our next meetings are?
Oh, sure.
All right.
Do you want a motion to adjourn?
Thank you.
Well, she wants to talk about.
Sure, talk about the next
She
meeting.
just asked.
Yeah, after that, then we'll just need a motion.
Yeah, that was your,
Yeah.
yeah.
So Pam, when is the next meeting scheduled?
August seventh, I think, yes.
And do you have a meeting set with the executive yet or not?
We don't have the exact time, but I believe it's gonna be the end, the
The
last
end of August,
week of August, and typically I ask for Wednesday because that's usually, I'm thinking it's gonna be that last Wednesday from 9 to 11.
And August 7th is in Oshkosh or Neenah?
August seventh will be in Oshkosh again.
Oh, okay.
Because we just got it out of sequence.
We're out of
Typically,
sequence.
we wouldn't have a meeting in July. And so then August would be back on our rotation.
Oh, yeah.
So we're just gonna do two in a row. Oh, I do have another quick announcement, that John Damo is recommending Mark Weisensell for
Oh, wow.
replacing the citizen member vacancy.
Oh, that's.
And some of you know Mark Weisensell, some of you don't, but Mark was here, retired 4 years ago. He was in charge of the aging and APS area. And Mark is submitted his application to be a citizen member, and John is recommending him tomorrow night to the county board. So if that happens, then Mark would join us in August.
Good.
And then our September meeting is on September sixth.
I was just going to mention, that is correct, it's on Wednesday, September
September
sixth,
sixth, yeah.
due to the holiday.
Holiday, yeah.
In Neenah.
In Neenah.
I will not be here on this August seventh.
Hopefully you're gonna be someplace fun.
Door County.
There you go, that's it, there you go.
That's one.
Oh.
You doing the wine tour?
No, I stay as far away from civilization as possible when I go there.
I know people who take the wine trolley.
No
I've
wine
never
trolley.
taken the wine trolley, but I hear it's
It's
quite the
fantastic.
excursion.
I've seen people line up for it.
Drive me around to wineries and I don't have to worry about driving. It's fantastic.
All right, then. that's
Motion
it.
to adjourn,
Now, entertain a motion to adjourn.
so moved.
Second. Debatable, all those in favor say aye.
Aye.
All those opposed? Ayes have it, passed.
Okay, the food should be here very shortly.
What did you guys think about this shortened,
It's nice.
best budget, shortest budget meeting ever? Yeah, versus the book? Yeah, is
Yeah.
that okay?
Sure.